I'd like to welcome Dr. Peter Levine. We're doing a somatic shift here today. He is the creator of Somatic Experiencing and has written many books that I have personally enjoyed. And he has over 60,000 therapists trained in his approach. So it's an amazing honor to have you here and to guide us through a somatic shift today.
Sure, gladly. Pelvic dysfunction can be a very difficult thing to treat. But if you know what really causes it, there are things that you can do that can greatly shift those pain syndromes. Somebody wrote a book called, I think it was called The Headache in the Pelvis, somebody at Stanford. And really, the way I look at the pelvis, the pelvic organs, and also the abdominal organs, is they're like, if you've ever seen a sea anemone or a jellyfish, so a sea anemone, if you gently poke one part of the sea anemone, it contracts and then it releases. And then if you poke it again, it contracts and it stays contracted a little bit longer. And after you've done that 4 or 5 times, it goes into a state of contraction. And that is really what happens when we have trauma and accumulated stress in the abdominal and pelvic areas. The question, of course, is what to do about that. There's actually a very simple exercise that can be extremely powerful, and I'm glad to lead you on that and then just see what comes up for you. And so I'll guide it. Now, the idea is, let me give you a little anatomy and physiology. There's a very big nerve, the biggest nerve in the body, that goes from the back of the brainstem, down through the diaphragm and to all of the organs below the diaphragm, particularly the gastrointestinal system and the pelvic networks systems, and also it goes to the heart and the lungs. And this nerve, again, largest nerve in the body, and 80% of that nerve is afferent. In other words, they're sending information from our guts, from our pelvis, up into our brain. So, for example, you go outside of your house and you look and you see that somebody's been injured. Maybe they've fallen off a bicycle. And you go, your guts twist. It goes, ah. And if you see that there's a really severe injury, of course, you call for help and help the person. But again, your guts go, ah. Now that is sending the information from the brain, which recognizes threat, danger, and affects the organs. But then all of the organs, like this gigantic jellyfish or sea anemone, sends information back up the vagus nerve, and then it gets amplified in the brain. So you can see once there's been injury or trauma in the gastrointestinal system, in the pelvis, it can continue to perpetuate itself. There's a condition, for example, I think it's called interstitial cystitis. Again, it's a difficulty in urinating. Again, it's that contraction. So the key here in somatic experiencing, we have a term called pendulation. And so whatever we're experiencing, if it's trauma, it's like a contraction. And so when the person begins to feel the contraction, they brace against the contraction, and the contraction gets even stronger. But if we can gently titrate the experience and help the person move gently into the pendulation, then there will inevitably be an expansion and another contraction and another expansion. And finding this rhythm gives us access to this vagus system. So, following so far?
Absolutely. It's an amazing, very good explanation. We appreciate you going into depth on the scientific anatomical side. So
Yeah,
it's
yeah,
really
yeah.
clear how we can reverse what's happened with the sea anemone of the pelvic floor contraction with
Exactly.
pendulation.
And it stays contracted. So how do we shift out of that?
Mhm.
So, actually Darwin wrote about this nerve in his book, The Expression of Emotions in Man and Animals. And he got it. He got it that this nerve, in his words, was responsible for gut wrench and heartbreak. And that was just so completely right on. But the question that I asked myself and to teach to my trainees is, how do you get this system unstuck so that the contraction then can go into an expansion? And so I experimented with many different types of breath and sound. And I came to this sound, which is it comes from an easy full breath. And on the exhalation, to make the sound vu, as though it's coming from here in the belly, and just letting the sound and the breath all the way out. And then just wait for that next breath to come in, filling belly and chest. So I'll demonstrate it. And then, Michael, if you want, please join with me. So again, easy breath and vibrate that sound that's coming from the belly, because that is telling that the coast is clear. And because it's a different signal than that repetitive contraction, it's a gentle expansion. And the sound is like, "Voo."
Voo.
Let the breath and the sound all the way out. And wait for the breath filling belly, chest.
Voo.
And just rest. And just take time to experience Michael sensations, feelings, thoughts, images. Just settle there. That's it. And just enjoy that quietude. You can see you're deepening. I notice the colors in your face have changed, become more rosy. Your breathing is less labored. It's more spontaneous. So, yeah, exactly.
Amazing. It's very, very quick shift from one sound, one breath.
Exactly. Exactly. One breath, two breaths. It's really amazing. Now, there's another thing I want to talk about. Again, this is sort of anatomical. Is the diaphragm, of course, is got the largest square footage of all the muscles in the body. And it's this enormous dome. It looks something like this. And so when we breathe in, the diaphragm contracts and there's a negative air pressure and the air goes into the lungs. And on the exhalation, the diaphragm recedes. Now, there's another diaphragm that's a mirror image of the respiratory diaphragm, and that's called the pelvic diaphragm. And that's the floor of the pelvis. And if we can get that vibration and shift out of the stuck, contracted place in the pelvis, then many of these symptoms can begin to shift. So again, that image of the diaphragm, respiratory diaphragm like this, the pelvic diaphragm like this, like a mirror image, really. And if you just look at it anatomically, just see how incredibly beautiful that relationship is. So when our diaphragm in our upper body, our respiratory diaphragm, when it releases, the pelvic diaphragm does exactly the same and changes that whole feedback system from the organs back up to the brain. And it says, let go, give into that expansion. But remember, with every expansion, there's another contraction. And with every other expansion, there's again a contraction, but you can see it becomes more and more expanded each time. So this is, again, a very simple exercise that people with pelvic pain and other pelvic dysfunctions can experience by just doing this simple exercise.
Yeah, it's incredible. So you're talking about the VUing exercise and
Yes,
doing it multiple times in a row. So once the softening of the diaphragm happens, the softening of the pelvic diaphragm happens more easily.
exactly. And now there's a third diaphragm, and most people don't think of it as a diaphragm, but it is. It's the thoracic inlet outlet.
Hmm.
And when, for example, we are threatened, well, think about this. That's right. It's that whole area here. It's not anatomically not as the same as the other diaphragms, but it is a diaphragm. And so, for example, you're driving in a car, and all of a sudden you see somebody coming right towards you, and you take a deep, easy out breath, right? Well, obviously not. You
No.
don't. You gasp. And again, that gets stuck here. The shoulders gets exactly just the way you're demonstrating. Again, often people have pain in their shoulders, very common. So I would generally ask the person, well, if you feel underneath that pain, do you notice a tension? Most people say, yes, my shoulders are really tense. So then what might happen if you let that tension get even stronger and the tension then just goes up and then lets go? So again, you don't do it in a macro movement, but in a small movement, the shoulders coming up a little bit and then letting go. That's it. So going up and letting go and letting go. And again, just feel that out breath. And again, notice sensations, feelings, thoughts, images, whatever comes to your mind. That's it. Right. Again, I'm just noticing a spontaneous ease in your breath. And again, a wave of warmth coming up into your face. I wonder if you're noticing anything like that.
I couldn't see it, but I did feel more of a relaxation,
Yeah,
just less of a holding on mentally and physically.
exactly. So again, as this diaphragm releases, the respiratory diaphragm releases. The respiratory diaphragm releases, the pelvic floor diaphragm releases. Anytime. Anytime.
Very helpful.
Yeah.
Amazing. And would you like to share the other practice, the pendulation one?
Well, I've been kind of mentioning that all along, but let's look at the shoulder one.
Great.
Let's, sometime, unfortunately, children are hit by parents or bullies or older siblings. And so, for example, if we expect that we're going to get hit, again, we protect ourselves by raising our shoulders. And if it just happens once or twice, most of the time our shoulders go back down. But if it happens habitually, our shoulders then start to stay up. And again, we start feeling that pain. And again, it refers indirectly to the pelvic pain. So again, just doing the exercise of increasing the contraction and then releasing expansion. Slowly, just rest there. Again, I'm just noticing a shift in the warmth in your face.
Yeah, it's amazing when you do the contraction, the expansion truly is more expansive. There is
Exactly.
more rest than if there wasn't the prior contraction.
That's right. And again, sometimes it's surprisingly quick, like you mentioned right at the beginning. A few years ago, we did a retreat for military people for vets or people who were active in the military. And we were doing these kinds of exercises with them. And then often I'll just ask for sharing what different people noticed. And this one guy said, this is unreal. What happened in 1 minute, in 2 minutes, would take me 4 or 5 hours of meditation to get to. Archimedes, the early Greek, I think it was Greek scientist, philosopher, he said, if you give me a place to put my lever, a fulcrum, then I can move the world. And I really believe it's these kinds of exercises that can provide that fulcrum and give us that expansion and back into ease.
Absolutely. It doesn't have to be hard. It doesn't have to be a mental exploration.
That's right.
It's about being with what the body needs to express. And that's why
Yes,
I like these movements a lot.
correct. Correct. Yeah, again, it's deceptively simple. It's almost too simple to work,
Yeah.
except that it does.
Yeah, exactly. There's a part of the mind that thinks it has to be hard and may have that belief system in place, and it doesn't have to be.
Exactly. And again, especially when a person is symptomatic, when they're having pelvic pain, pelvic dysfunction, it seems like it'll never change. But again, if we meet it gently and one small amount at a time, I call that titration, then it can shift. And I guess that's my message.
That's amazing. We're so supportive and appreciative of the message because it doesn't have to be hard.
No, it really doesn't. It really doesn't. Yeah. So again, practice these exercises, and it's good to do it sometimes with a colleague, with a friend. So you have somebody there with you, for you. So there's a Motown song that goes, takes one to stand in the dark alone, takes two to let the light shine through. So again, to practice these things, not, of course, by ourselves, but also with an attending other. In one of my books, In an Unspoken Voice, I write that trauma is not so much just what happened to us, but it's rather what happened in the absence of a connected, empathetic other. So when we have the other, because again, trauma is what got these things locked in, and some sensations and feelings and images and memories from these traumas may come up. Don't have to. It's not necessary for the healing, but sometimes they may come up. So again, it's good to have somebody there with you.
Yeah, having a compassionate container for the reflection to come back to you, a reflection that's love this time instead of a reflection of seeming danger.
That's right. That's right. Yeah.
Amazing. Yeah, I feel like you're already somatically shifting me and open to more.
Yeah, and again, those people who are interested, we have offered trainings actually in 44 countries. So they can check. And also, if it's okay, I can just mention some books that can give further information.
Definitely.
Yeah. Well, the one I just mentioned is called In an Unspoken Voice, How the Body Releases Trauma and Restores Goodness. And my first book, Waking the Tiger, Healing Trauma, is really about these basic principles. And my most recent book is called An Autobiography of Trauma, and it's really the truth of how I came to this work, of what I'm sharing with you through my own injury. There's a Greek archetype called Chiron, which has the meaning of the wounded healer. And in order for us to be healers, we need to do our own work. And then that was really the basis of writing my story in my most recent book, which is called An Autobiography of Trauma, A Healing Journey. Again, of how I had to come to my own wounding to heal that, and then to be healer and to be a teacher.
Mm-hmm. Yeah. I also came to the work that I do because of my own severe pelvic floor issues. And I
Of
just
course.
finished writing a book that was semi-autobiographical
Oh,
and
wonderful.
guiding principles as well.
Yeah.
In
Oh,
one
great.
place, kind of a combination of the way you wrote your
Sure.
books.
Sure. Yeah. Yeah. I mean, I really encourage people to write their own stories,
Mm.
and when I wrote this book, it was originally just to be for myself. But a close friend said, no, you really have to make it as a book because it can help people with their own healing to write their own stories. And so that was one of the things I wanted to leave with all of the people who are suffering from these different kind of conditions, physical, psychological, emotional.
It helps someone see that they're not alone and that this is a
Yeah,
common human experience
that's right.
and that there is a deeper way to introspect.
Yeah,
And it doesn't have to be mentally introspective.
that's right. In the diagnostic level of trauma as PTSD, it says something that's outside of the normal human experience. Well, no, many things that happen in normal experience are affecting our bodies and our minds. I mean, that really was the beginning of somatic experiencing because I was, say, fortunate to not know that trauma was, as it later, like 10, 12 years later, became defined as PTSD, but and which was supposedly a brain disorder, maybe even a brain disease, which couldn't be cured, but could only be managed by helping people change their negative thoughts and different medications. I'm not against medications for temporarily, they can be helpful. But I realize it's something that happens in the body, just the way we've been talking, and gets locked in the body. And it has to shift in the body in order to free the mind, to free the brain.
Yeah, absolutely. I mean, so if someone does the VUing technique, let's say, and perhaps they just start doing it when they feel called to or even daily, and maybe their symptoms are improving a bit, maybe they're not.
Mhm.
Are there any other things you recommend beyond working with a somatic experiencing guide as an example?
Yeah,
There are
sure.
lots of having someone there hold space is beneficial. Is there another tool? Let's say if you were experiencing tension or pain in that part of your body, is there another go-to, or is that simply the primary way in? You want to breathe, open the diaphragm, and feel what's beneath it.
Now, there are many, many, many things to do. For example, many people don't have a relationship with their bodies. And so you ask them what they're experiencing in their body, they don't have an experience in their body. So a very simple exercise that I will do with somebody who doesn't have any sense of their body is as follows. There are a number that I could do, but this is a very, very simple one. So I have them look at their hands, just look, observe their hands, and notice if the hands are more open or more closed. So maybe just close the hands a little bit more and then open the hands, just looking at them and just see how it looks. Now, Michael and everyone, just put your mind in your hands. So you're seeing your hands, but you're also physically feeling your hands contracting and sensing and feeling your hands opening. And again, feel them going, contracting into a closed fist. And maybe just notice if there's any sense of power there or even anger. But whatever it is, just sense it, just feel it. And just notice the contraction and then let it open into an expansion. Open, again, feeling every piece of that. And maybe imagine that the open hand is reaching for something, something that you really want for yourself or in your lives. And whatever that is, just holding that in your hands and bringing it here into your chest, into your heart, and just feeling it there, letting it rest in your body, in your chest, in your heart. Good, good. Yeah. Again, it's deceptively simple, but with somebody who's not have any sense of their body, this can begin to bring them home.
Yeah.
And just noticing your hands right now, and just sense how that feels physically. Good. How does that feel to you? What's the felt sense of that?
There's a presence of life. There's a life force energy that I feel.
Wow.
And
Wow.
there is a lessening of the mind. So the thoughts are just falling away.
Great.
There's blood flow. There's texture and touch and stickiness. It's very much coming into, yeah, the body, not
Sure.
the head space and
Yeah.
somewhat of the body.
Right. Right. Yeah. So again, giving yourself this gift of deep inner relaxation and feeling more alive. So what happens if you just say this sentence? I give myself this gift of inner relaxation, and I'm alive, and I'm real.
I give myself this gift of inner relaxation, and I'm alive, and I'm real.
And again, just notice how that feels inside.
More of an opening in the heart space.
Like, great.
Yeah. And like a gong sound that reverberated through that I'm alive
Interesting.
and I'm
Yeah.
real.
Yeah.
Yeah, like a celebration of being here.
Yeah. Yes. And this is like, the mudra of thankfulness. Hmm.
Deceptively simple.
Simple. Yeah.
Amazing. And if someone is doing these practices and they are feeling some of the things that I just shared, and then they like their mind comes in later in the
Right.
day and they're like, well, but I
Yeah.
still have the symptoms. Do they need to figure out where it
No,
came
that's
from?
great. I have a trick for that one.
Okay.
It's my version of CBT, cognitive behavior. Okay. When I'll do, for example, the demonstration, and I'll say not if, but when your mind clicks in and it's saying, this isn't going to last, or nothing really happened, that's fine. Just notice that thought and preface it with the sentence, the words, very, very simple words of, I have the thought that. I have the thought that this isn't going to last. I have the thought that nothing really happened, because what it does, oh, okay, wait a minute. I have the thought. It's a thought, only a thought. There's a wonderful poem that a girl from Uganda wrote, 10-year-old girl from Uganda. And she said, I have a little brain that's tucked safely in my head, and the other one that's in the air instead. That one follows me and plays with me in bed. The other one confuses me, the one that's in my head. And when I give people that poem, they just burst out laughing or just a smile.
So amazing. I love that. And I have a thought that is, wow, that is just completely deconstructing belief in thought. Beliefs
Yes,
that the thoughts are true, and just because you're thinking something doesn't mean it actually is true.
exactly. I have the thought that.
Yeah.
Da, 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 da.
Yeah. I have the thought that, and it's more of leaning into what you're experiencing and feeling versus just what the mind is labeling or generating as a
Yeah,
story.
yeah. And it can go on and go. I mean, it just, it doesn't know anything else except to go around in circles. That's what it does. Sometimes it's useful, like you're trying to figure out a problem in calculus or something. But other times, it's a good slave, but a very poor master.
Yeah. It's a meaning making machine. It wants
It is,
why.
which is, we are meaning-making creatures. So it's important. But again, if it just takes over, it just robs us of our own vitality.
It's incredible. Yeah, this has been extremely helpful, Dr. Levine. Do you have any final practices or anything at all for someone dealing with issues in this part of their body?
Well, again, in Waking the Tiger and then and another book, Healing Trauma, I do a whole bunch of different exercises, many different exercises. And then in the autobiography of trauma, I use some of these awarenesses that I've used for my own healing and which I invite others to use for their healing.
Beautiful.
But there are many, many different exercises. And therapy is, it's not just exercises, but when you use it in a therapeutic way, it's a positive adjunct for therapy.
Hmm. How would you distinguish using it in a therapeutic way versus a non-therapeutic way?
I was afraid you were going to ask me that. I don't really necessarily distinguish them.
Okay.
You know, it depends. If in a therapy way, you really want to be working with a therapist,
Mm.
with a guide. You know, when I started having these very difficult sensations, symptoms that were coming up, and flashes of images, I asked one of my students to be my guide, to sit with me while I explored some of those. And in SC, somatic experiencing, we don't go right into the core of the trauma. We look for something that's important around the periphery. So what first came up was a memory. When I was 4 years old, my parents must have come into, it was my birthday. My parents must have come into the room at night or early in the morning and laid model railroad tracks underneath my bed and around out into the room in the back underneath the bed. And when I woke up, the train was going around and I was beyond excited. I jumped out of bed. I went to with the transformer and making the sound of the whistle. And in that moment, even though I didn't have the words, I knew that I was loved, that I was cared about. And that let me go to another memory, which was violent and had to do with the mafia threatening the life of my family. But going back and forth, as I illustrate in the book, was able to really undo that and put it in the past. But as much as I know, I don't think I could have done that in the absence of a guide.
Yeah. No, that's extremely important to have someone be there for you in such difficult moments and to
Exactly.
ask the questions that you may not even want to ask yourself anyway. Maybe
Yeah,
the distraction patterns are helping you hide from them. So the guide can
sure.
safely bring you a little bit further into the
Yeah,
darkness.
yeah. I mean, we do that. We really kind of just find all kinds of things to think about and worry about.
Yeah.
Many people are on their devices for extended period of time, and that's one way of disconnecting from our bodies, because we're just in, this. And it's too bad. I mean, it's wonderful. It's amazing. Here I am. You're in Sedona. I'm in Big Island, Hawaii. And we're talking to each other with a computer. And that's incredible.
Yeah,
But it has its downside.
absolutely. Could be said about anything, big glass of
Exactly.
wine, bad to be an alcoholic, etc. So,
Yeah, right. A nice glass of wine is fine with some friends.
yeah.
Yeah,
Amazing. Well, Dr. Levine, thank you for guiding me and for everyone who is watching today.
sure.
We'll be linking your books, your information. I highly
Great.
recommend everything that you create. I think
Sure.
you have a very tender, connected, yet intellectual understanding of the mind and the body
Yeah.
all together, and it's a beautiful
Yeah.
combination.
Yes, absolutely. Absolutely.
Thank you, Dr.
A
Levine.
pleasure. Yeah. Enjoy the day.
Take care.
Bye.